Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's ENT topic is the snoring and sleep apnea. We will discuss this topic in 5 sections. In the first section, we will talk about the terminologies, mechanism of snoring and what's the etiology or different causes of the snoring. Then in the second section, we will talk about the sites of snoring. What are the different sites where in which the problem is that leads to the snoring? What are the symptoms and how we can treat the snoring? Then in the third section, we will discuss the sleep apnea. What are the different types of sleep apnea? Physiology and pathophysiology of sleep apnea and consequences of obstructive sleep apnea. In the fourth section, we will talk about the history, body mass index and collar size, systemic examination, and polysomnography. So these are all different clinical evaluations that can be done for the apnea or sleep apnea. Then in the fifth section, we will discuss the management of sleep apnea, like different lifestyle changes that can be done to treat the sleep apnea, and then also the positional therapy and intraoral devices used for the treatment of sleep apnea, and also CPAP. This is known as CPAP, continuous positive airway pressure, which helps to treat the sleep apnea. So all these disorders we will discuss. Mainly all these sections will be related to snoring and sleep apnea. So keep watching sqadia.com to learn about this topic.